in this room, especially after that powerful panel, and we're going to continue that same energy and momentum. My name is Catherine Martinez. I am the Strategic Policy Manager for NCHWAW, and this is also my first Unity. I am extremely impressed with all the work that has been put in, not only into attending this event, but the energy that we're bringing. And we want to continue that energy by figuring out innovative ways to continue to lift our advocacy, our voices, and create real sustainability for the CHW workforce. So thank you again so much for being here today. We are going to kick off our panel today by really learning more about all the incredible advocacy efforts that are happening all around our nation by our powerful CHW leadership. I want to start off by reintroducing our fearless leader for NCHWAW, Denise Octavia.
Is it still morning? I don't know, but I know that I'm in the right place. So hi, everyone. If you were in, how many of you were in the last session, the founders session? Okay, they queued us up tremendously for what we're about to do today. First, let me just acknowledge and thank Catherine Martinez for joining the NCHWAW team and for doing such a phenomenal job continuing the vision of both carrying the values of the founders and the advocacy work that we've been doing for the last 3.5 years. You see that I have an incredible panel of leaders who are on the stage. So I'm going to be brief, but I recognize that everyone is coming into their awareness of NCHWAW in different ways. So let me quickly just say, because also you're getting to know me as the ED of NCHWAW, and I just want to say something briefly. I have been a community health worker for 25 years. I always think about my oldest son, and I add 2 years, and I have 4 children. So that's sort of the way that I do it. And it came really organically. My grandmother had a fully operating farm. We gathered eggs, we grew vegetables, we milked cows, we went to the slaughterhouse, and we delivered that food. My mother was an HIV advocate. So if you remember the silence equals death period of time, the early 80s, my mom took me to those events, and eventually she, had a job in our state Department of Public Health in Connecticut. I was telling some other folks the other day that when I was 11 years old, my mom gave me a t-shirt. And there was a white t-shirt, and it had a cartoon penis on it, and it had a little cartoon condom hat sort of cocked to the side, and it said, "Cover me, I'm going in." And my mom told me to wear that t-shirt. She was like, wear it to the bus stop, I want you to wear it to school, go to the playground. And my older brother was mortified, right? Like, oh my gosh, why? Why do I say that? Because many of us don't necessarily consider ourselves policy experts or advocates, okay? Many of us had a journey even to advocate for ourselves. I am a survivor of a rare chronic disease, and I can tell you, even though I had been a CHW for a couple of years, well over a decade at that time, when I had to leave my job, when I was bedridden, when I was in and out of the emergency room, I had trouble advocating for myself. Had lots of different doctors and providers to see. Part of my journey was to understand that the voice that I had been using for others in my community, I had to use for myself. And I think there's some healing and some imposter syndrome that we need to break down to understand our powerful role as advocates and why it is so important for us to be in all the spaces and places where decisions are made and where power resides. You need to see your face, you need to see your lived experience represented. The National Association of CHWs was called to national advocacy because, as I mentioned earlier, we have grown up in the midst of the COVID pandemic. So 3-4 months after I took this role, I started getting calls to, get on webinars, etc. And I bet you've all had this feeling. You've been called to a meeting, And you got to that meeting and there were a lot of PhDs and MDs and a lot of letters, a lot of powerful people. And you might have been thinking somewhere in your brain, why did they ask me to this meeting? Y'all are getting paid to be here. Oftentimes we don't get paid to show up to the meeting. But sounds like y'all should be able to solve the problem. Haven't you been researching the problem for a long time? Haven't you been writing about the problem for a long time? But here's what I want to say, because I had this experience when I was in Connecticut as a CHW. I would come to this room and I would sort of sit in the back and I would assume that whatever I was thinking, someone was going to say. And then when I listened a little longer, I realized, you know what? No one has said what is burning inside of me. No one is speaking the language of my community. I haven't heard yet the articulation of this problem. So what I want you to say is, whether or not you have the title of policy this or advocacy that, whether or not you've been trained in policy or advocacy, and whether or not you're an expert in Medicaid or Medicare or the ACA, we need your voice, we need your experience, your commitment, and your passion to this movement of policy and advocacy. You've seen some of the things that the National Association has attempted to do to codify and really aggregate the policy language again that has been around for many decades. There is a legacy of policy and advocacy from CHWs and allies coming together, whether it's through the American Public Health Association or the National CHW Policy Platform that NCHWAW released in the midst of the pandemic in February 2021. And then just a few months ago, it seems like a lifetime ago, a number of us got together, and I'll close with this. As we began to understand that the public health emergency was unwinding, and you all understand that the American Rescue Plan Act had in total about $7.6 billion for COVID response, and the Centers for Disease Control released $3.2 billion to every state health department, about 30 or so big cities and some of our territories. What is being called the largest investment of public health in a generation. We do not know if we will ever see investment like we are seeing right now again. $3.2 billion, not for data infrastructure, but to build the public health workforce. Community health workers are the front line of the public health workforce. And oh, by the way, that $3.2 billion, those are your tax dollars. And those tax dollars need to be very hard at work. They need to make sure that we diversify this workforce. They need to make sure that we create pipelines and not barriers and restrictions for persons of different lived experience to come and bring their expertise to make this public health workforce trusted, culturally and linguistically aligned, rooted in community history and trauma, and bringing forward our innovations and our solutions, because there will be a next. There will be a next pandemic. There will be a next. Some of you are experiencing the opioid, the fentanyl crises. Some of you have been experiencing crises for generations. Generations of poverty, generations of diabetes. Our STD rates are rising. We have challenges, and without the workforce being sustained, without the workforce being identified in national policy and advocacy and in state level policy, we will not have a respected, protected, or authentic workforce. This is why the National Association has decided that we would like to invite you to be a part of the first ever National CHW Awareness Week. Now, Catherine is going to tell you about all the tools and resources that the team has put together. We've again mined the expertise of our members and our partners to bring tools and resources to you. But on the stage, you have individuals who have been advancing policy and advocacy for decades. They can tell you how they cultivated their leadership, how their leadership led to organizing and movement building in localities and states and nationally, and they can talk to you about the strategies that work. So I want you to trust your leadership, okay? I want you to call yourselves leaders. I want you to know that we see you as leaders. And together, I think we're going to have a National Awareness Week that is going to shake this nation, that is going to position us to be exactly where we need to be to make sure our workforce is pursuing and achieving sustainability. I want to thank you so much for joining this session, and thank you in advance to the panelists.
Thank you so much, Denise. And we are going to go ahead and jump in and get started. Denise, I would love for you to engage the panel in really talking through not just what we're asking you to do in terms of CHW Awareness Week and the advocacy, but also tell you a little bit how it's been done by some of our experts. So I will start off with Denise.
Okay, microphone check, 1, 2. No, just kidding. Sorry, just kidding. That's for the gala. Okay. So I was saying to Lisa Renee Holderby Fox, one of the founders of the National Association, one of the founders and an individual who helped build the Massachusetts Association of CHWs, one of the individuals helping to build the Georgia CHW Coalition. She's an OG, okay? There's no other way to say it. I was saying that the Founders Panel really queued us up, right, for this, and that what we're elevating and amplifying is a history of decades of advocacy and policy wins and achievements. There's a lot that you can share with us, but help us to understand why in this moment, one, we need to be unified, and the type of policy wins in the past that will help set us up for the future.
Sure. Thank you, Denise. Before I say anything else, I just want to express my excitement about a National CHW Awareness Week. That's right. And don't be bashful about being excited about this week, right? We want everybody to have the excitement that I have. But for years, CHWs across the country, CHW associations, networks, etc., have organized CHW Awareness Days in their home states. As Denise said, I'm from Massachusetts originally, living in Georgia now. But in Massachusetts, where I've done most of my work, we were able to successfully get the governors, because it was more than one governor that did this for us, to proclaim a CHW day, and so they draft a really fancy proclamation, and it's cool to read at your annual meeting or your meeting when you bring all the CHWs together. But it was a document that really recognized the work that we do in community. Well, after the first year, Denise, I'm thinking we're golden. Folks are going to know who we are. We just had a proclamation from the government. Yeah, exactly, right? It's funny. Because that's not what happened. So then we get another proclamation. We even got included in the Massachusetts healthcare reform law. Well, everybody's going to know who we are then. Nope. Right? And so I just want to elevate that all of the small steps that the states are taking are crucial. But it's not quite enough to make sure that people know who we are as a workforce. Georgia had a very successful CHW Awareness Day in March. But I can guarantee you, as successful as that day was, there are still folks in Georgia saying, and who are CHWs? And in 2010, we were able to get a standard classification code at the Department of Labor. And that was a lot of work. It took us years to develop a CHW definition that folks could live with, right? Because it's not perfect, but we got consensus from across the country, CHWs who could live with that. And that work was started in the policy committee of APHA, because again, that was the place that we all gathered. But we understood a definition would be crucial to make sure that folks understood who we were. And so once we got that standard classification code, once again, of course, folks are gonna know who we are. Well, everybody in the room knows that we're still going through this today, right? Who are we? Who are we? And that was, though, the first time CHWs on a national scale got together to do some advocacy for the workforce. We were successful, but again, we're still struggling 13 years later, who we are as a workforce. And I just want you to know, Denise, how excited I am, because the National CHW Awareness Week builds on the previous work, builds on the work that we did to get a standard classification code, builds on the work that's happening across the country in states around CHW awareness. And it's once again the time that we all will need to come together to make sure that our voices are heard and folks understand who we are as a workforce. And so again, I'm just really excited that we've got a national association to lead the way, to open up the doors for all of us in this room and all of us in our home states to come together around CHW National Awareness Week.
Really excited to hear next from Venus Gines, the Executive Director of Dia de las Mujeres y su Familia. I met Venus right at the beginning of the pandemic, and I so appreciated that she just reached out and said, yeah, I know what you're going through. I've been in ED for a couple decades. You know, welcome. Venus and I have had many interactions during COVID-19, and I remember attending one of your virtual conferences, and there were well over 700 promotoras and CHWs there, and you had already been engaging and had, you know, prominent representation from your Department of Public Health and a proclamation from the governor. But as Lisa Renee said, we know that the work continues, right? That it's every day we're continuing to elevate who we are and our value. Can you talk to us about your own advocacy, both in your state and nationally, and how you think the CHW Awareness Week can help further our cause?
Sure. Well, thank you once again. Muchísimas gracias a todos ustedes que han llegado aquí. Las quiero mucho, promotoras y community health workers. Un aplauso para nuestras promotoras. So for those of you who are linguistically disadvantaged here, I was just welcoming the promotoras. So since 1997, I've had the honor of training promotoras and community health workers. So we are 26 years. We are very dedicated to our promotoras. I don't know if you could show the one slide, the first one, please. I don't know if you can do that. But in the meantime, I wanted to share with you that our project was inspired by God. I am a breast cancer survivor. I lost a sister to cervical cancer. And in 1997, I wanted to have something that was very cultural. And I started our first health fiesta. And I had my colleagues and friends from CDC, because we were in Atlanta. We had our first promotoras training. And then the rest is history. And hopefully you'll get the slide where you see where we are. As far as the United States, there we are. This is all the training that we have done across the United States and Puerto Rico, Dominican Republic, and now the University of Baja California Sur has taken our promotora training as part of their curriculum. So I thank God, because I could never have thought of something like this. But I also thank our promotoras who have been along with me, training me and teaching me about what's going on in their communities. So like I said, in 2009, I moved here, and I was an instructor at Baylor College of Medicine teaching cultural competence and health literacy, but still having my foundation of Dia de la Mujer Latina, and I applied to become part of the Community Health Worker Promotora training, sponsored training program, and it took me a while for them to recognize a community-based organization, especially one that had its name in Spanish, to be admitted to this board. But I got in. And I brought in Maria From El Paso, I brought Merida from the Valley, and before you know it, we had a good group of promotores within that advisory board. Why am I saying this? It's because when you get to a point where you are in a room and you see just people that may have your intelligence or your all the letters behind your name, you really need to bring the real folks that know about community. So you need to bring them to the table. And not just think, oh, I can speak for so-and-so. No, I cannot speak for my Latino community. I need reinforcement from a lot of people. And I've been privileged to meet wonderful people like Maria from Visión y Compromiso, Margarita Holguín from San Diego, and Wandy, and all these wonderful people who are doing some great work in their community. I've learned from them. And it's always try to be humble when you're working with your community, because they'll know immediately if you're fake. So this is the kind of training that we do. We with COVID, we were the first training program for promotoras and community health workers in February of 2020, before the pandemic was even started. Many of our promotoras and community health workers were asking about this, and I thought, well, let's go ahead and develop a training. We did, and through some of the sponsorship that we received from Pfizer, we were able to set up 10 hotlines and then a telehealth community navigation call center. Our promotoras are staffing that. The Health for Yeses, we teach our community health workers to expand their role. Since 2011, becoming patient navigators, clinical trial community navigators, behavioral health community navigators, meaning that with COVID, there was so much anxiety and stress. We needed the community health workers to understand how it was infecting them, but how they can help work with their community during this time. So in 2019, we started advocating for a bill, one particular bill, and that's the Medicaid bill to include community health workers in that care coordination. And it took us two congressional sessions, but the next slide I'll show you, we got it. We got it. So in the next slide, you'll see our promotoras, over 300 plus community health workers and promotoras went to Texas, and on April 14th, the governor had given our organization that proclamation, but we took it to heart and we visited all our legislators, and it passed unanimously in a very, I wouldn't say Republican, because it was very, can I say it here? Very contentious legislature, and it passed unanimously in both. So we can do it. Sí se puede. So I just wanted to share with all of you that with Denise and NCHWAW, I am here for you. So if anyone wants to know the steps, I'll be working with Denise and NCHWAW. I'll give you the steps of how we did it, and what's the language, and how this is going to bring more health plans to the table to recruit and hire more community health workers and promotores, because now it's the law.
Thank you so much, Venus. I want to also bring forward Oretta Tupelo. Oretta is a board member of the National Association of CHWs, a native of Hawaii, but now kicking things up in Utah. And as I was getting to know her as a new NCHWAW board member, and asking her, about her vision and expertise and just what she brings to this organization, one of the things that she shared with me were the advancements that CHWs helped to achieve in Utah around Medicaid. It was a really phenomenal story. We're actually writing an article about it. We've just been a little busy, but we'll make that happen. But if you could please share with us, Medicaid is on everyone's mind. We know that it's not going to answer all things for community health workers, but it is a piece of the answer. So would you mind just sharing with us what you did and how you did it?
Sorry, man, I'm so emotional right now. This whole conference has been such an inspiration because of all of you. Sorry. I want to thank Denise for bringing up where I'm from, because I am born and raised in Hawaii, and and I share that because I'm also born and raised CHW, because of the culture that I come from. We are natural gatherers of people, community organizers that have, I mean, this is ingrained in us from the womb. And so I share that to say, I mean, just think about it. I went from Hawaii to Utah. Very different in every way, not just the weather. So in the 7 years that I've been in Utah, I took my cultural strengths because I was born and raised by strong women in my family who raised me to be proud of who I am and to represent who I am and where I come from everywhere I go. So who you see and what you see here is how I am on a professional level. I take that voice and I took it with me to Utah, and not by chance, because I believe everything happens for a reason. They had an opening for the Utah Public Health Association section to organize a CHW section because a coalition of CHW work was being organized by promotoras in the state because they seen a need for workforce development and support. So they got a grant and started this work, and UPHA became a partner because of APHA having a section. And so we, because again, my background from Oahu or from Hawaii, I gathered all minority communities, our refugees, our Latinos, our Pacific Islanders, our Asians, anyone, our disabled, our youth, anyone who felt like they couldn't access resources. We gathered them all together, and it was hard because, again, I was new to Utah, but I went into communities, talked with their community champions and leaders, and brought them to the table first and said, hey, we need to come together and talk about what's going on here. And one of the promotoras had said to us, well, I don't understand this meeting. Why are you bringing us all together? We don't have the same issues. And I said, what can you give me an example of what issues we might not have the same? And she said, immigration. Pacific Islanders are all citizens. And I quickly was like, oh no. We also have immigrants here who are undocumented, and we are helping them with these kinds of things, and went down a list. And soon enough, the conversation became, oh, we go through that too. We go through that too. Those are the same barriers. So finding those commonalities brought us together, and we built a section. The first meeting, we had 3 members at the meeting. We now have over 200 members that are part of the section. The year after we organized the section, they wanted a curriculum, and they wanted to adopt it from Oregon. No shade to Oregon, but Utah said, no, we want our own. So I became a part of a 5-team curriculum writing team, and we wrote our curriculum for Utah and got it passed as the state core skills curriculum that now exists today. That curriculum helped us to boost the wishes of our CHWs, again, all led by CHWs. Jeanette Villalta was the lead promotora in a lot of this work. And after we wrote the curriculum, they wanted voluntary certification. We did our research. We looked at all of y'all's curriculums and legislation, and we decided to tailor the legislation that we passed last year to Utah and what the CHWs wanted there. So that was passed. We are now, since June 27th, an independent Utah Community Health Worker Association. And now we've led, and now our founding members are our existing board members for this association. But we did it because when I first got there, they were talking about sustainability and only had Medicaid down on their list. And I was like, why are you talking about Medicaid? You don't even have expansion. And so we pushed the conversation. They wrote a paper about it before it was even passed. And the CHWs came together and kept saying, we need expansion. There are so many of our people and our children who are not covered. And through these conversations, Riley Curtis led our efforts in getting expansion. And of course, look, we understand what it takes, but you gotta speak their language. So when we talked money and how it was gonna benefit the state financially, they listened. and they did their own research. And so now we have expansion, and that led to our discussions today with the Medicaid director and passing Medicaid reimbursement for CHWs in our next legislation. So I share our need to do this the way we wanted it to be done as important, because many of you have shared to me, oh no, I don't know anything about that. I'm not an expert at policy or Medicaid. But what we need is your voice to say that our people need it, that we are suffering every day, not just from COVID, and even though the money's going away, the disparities are still there. And we are the ones on the ground helping to address those disparities. So your voice matters in that you represent the communities that are being most disserviced by not having these kinds of policies passed. So I just want to say to you, echo what has been said. You all are leaders in this work. Your voice does matter. And when you're a community, and when I say community, I say family, because if you know PI, we are related to everybody. That's who I speak to. I start with my family, and then I spread the word, because we are Coconut Wireless, and that's how we get things done, is word by word of mouth. So please continue to share the needs of your communities, and sit at those meetings that might feel uncomfortable. I am used to being the underdog. I like to do things even harder when people say I can't do it and they don't expect it from me, and that's who we all are. So keep doing the hard work.
It's so good. It's just so good. Okay, next up, my sister, Honey Estrada, a proud member of the Hmong community, proud mama, proud Southerner, and executive director of the North Carolina CHW Association. Yeah, honey, you've been kicking things up in North Carolina. And, you know, you could speak from many different places. I think even getting the position and structure to have an executive director position, right? When we talk about sustainability, this is something that you were able to achieve. So there are many aspects that you could speak about. You also just recently, at one of our last quarterly NCHWAW CHW policy calls, these are webinars that we do every quarter, you also came online and shared with us about your advocacy day as Georgia and others, or Texas, were doing their days. So talk to us about what's happening, how you're organizing, and like, you know, Oretta said, the unique aspects of the community and what those needs are and how that results in the policy you want to achieve.
Yeah, awesome. Thank you. What's up, y'all? It's good to see y'all. I'm so privileged to do this work and honored to stand beside heroes. And like Oretta, I'm humbled and very emotional too, because this is the work of the heart. As the founders had said earlier, this is the work of the heart. I am a longtime CHW. My mom was a CHW. And so as I look out at all of you, I see myself in all of you. And I see you in me. I sit at the intersection of Hmong and American culture. So for the Hmong people in the room, Nyajong, it's good to see you. That's right. There's my Hmong people right there. I'm a proud Hmong American woman. It took me a long time to reconcile who I am. And that bleeds over into the culture of CHW work. And in North Carolina, I see my fellow peers and my fellow CHWs, and I know the struggle. So many of our systems want to put us in a box. I'm like, get rid of the damn box already, okay? Because and Denise spoke about this, yes, there was a big spotlight that was shown upon us during COVID. And in North Carolina, while we know that CHWs have been doing work in communities for decades and decades and decades, we were here before COVID. And yes, we were spotlighted during COVID, and we're going to continue to be here long after COVID. Because chronic disease doesn't go away, aging populations don't go away. those disparities don't go away. And as I look at my fellow community health workers who, we are a majority workforce made up of women of color who understand what it's like to come from disparaged communities, women of color who understand the struggle with the lived experience to address those needs in communities, right? And so what we're talking about here is a power dynamic and a power struggle. In North Carolina, during the pandemic, we did something very innovative, and I'm so grateful to our state partners who leveraged federal dollars to support and employ community health workers during the pandemic. And I remember getting a call from one of the leaders inside of the state office and said, hey, honey, we're going to do this thing. And at that time, I was not yet in the position to lead the association. And he called me and he said, we want to do this thing. We're going to release some dollars out, and we're going to have some vendors to hire community health workers. How do you feel about that? And I remember saying to him, I said, I think that's great. What's going to happen afterwards when the dollars run out? Because my CHWs are no longer going to have jobs. And that means that we go back into communities doing what we were doing before. And so I need to know, is there a sustainability plan? Is there a plan for us to think about how this is going to impact our lives afterwards? And he said to me, well, we will cross that bridge when we get there. Yeah, I know. And so $75 million came to support community health workers, and by gosh, we showed up and we showed out in North Carolina. Okay? I'm talking vaccines in arms, education into communities. I'm talking all the things. You know what I'm talking about. As a CHW, you know what that looks like. And then the dollars ran out, and contracts were ended, and positions were terminated. And we have CHWs calling saying, honey, I lost my job, and where do I go from here? So where do we go? What do we do? It's advocacy. It's advocacy with a little a, as Julie talked about earlier. It's advocacy with the big A. I want to shout out my friends at Partners in Health who have stood beside of us unwaveringly. Because this, yes, I know, give them a hand. In North Carolina, we organized our first advocacy day this past April. I was scared. I've never done anything like this before. I'm a CHW. I know what it's like to advocate for my community members. I know what it's like to advocate for my family. But now I have to go and talk to the big bad senator and the legislator and the representative and talk about all things CHWs. I was scared, right? I don't know what I'm doing. This is the first for me. And we did, we had some coaching sessions, and we talked through it, and we strategized. We talked about who the power people are, who the health chairs are, where their stance is. Allie did some power mapping for us. This is the senator, and this is what they like, and this is where they go to church, and this is where they live, right? We found out all about them. She did some sleuthing for me, right? But let me tell you, and that work, that strategy is so critical because it was really understanding who the power players are in the room. So when I walked into that room, I knew what to say and, more importantly, what not to say, right? And so we knew we needed to engage our workforce. And I remember sitting down with the planning team, with Lucas and with Taylor and with Devin, all from PIH, and my team from the association. And I said, you know, guys, like we planned this like less than a month too. So, okay, so I'm like, y'all, I'm gonna be really super stoked if we get like 10 or 20 CHWs to show up at the Hill, right? Okay, like if we get 10 to 20, man, like that's a win. 80 CHWs showed up. 80. Because these are leaders who are hungry for change, hungry for advocacy, hungry to make positive changes in their communities. 80 CHWs, over 80 as a matter of fact, who met with over 50 legislators that day to talk about CHWs and why we need sustainable funding for our workforce. And while that was the first CHW advocacy day in North Carolina, better believe it, this is not going to be the last. So as we embark on National CHW Awareness Week, I stand on the shoulders of these people up here who have paved the way, not just for me, but for generations to come. And so, yes, I hear my colleagues up here, my sisters, my family. You might be scared. I was scared. We had CHWs who were scared. But you know what? You can do this. And I said this in one of the training sessions. These senators and these legislators, yes, don't get me wrong. They're the power people. They got the money. They got the resources, right? But guess what? They pick their noses just like me. And, you know, and seriously, and they go to the bathroom just like me, you know, and all the things. So let's just be real, because again, it is the authenticity and the lived experience that we bring to the table that those legislators do not understand, and they need to hear our voices. And so, my friends, if I could leave you with anything today, you have a voice. And I know that our voices have been staunched for far too long. And today we rise up and we make history.
It's so good. It is so good. What's up with like a CHW channel? You know what I'm saying? You know somebody. Let them know. We are ready. Okay, listen. I want to next bring forward one of our founding board members. I was telling her they had her working yesterday to make sure that we had an incredible transition into FY24 with new board members being elected. I just want to recognize Floribella Redondo. Yes. I think they know you, Flor. I think they know you. Listen, you know, as leaders, I was just sitting here reflecting and knowing that every leader here, one of the things that we have to do is like read a lot. You know, we consume a lot of information. We're strategizing. We're always trying to think into the future. And before I took this role when I was a CHW in my home state, one of the documents that I happened upon was a paper that Flor helped to lead, and I didn't know her at that time, that talked about the Arizona CHW Association, NCHWAW is how folks know it, and the challenge and the successes, the strategies, right, the consciousness that they took to bring together community health workers, promotoras, and community health representatives from tribal nations. Now, let's be real. This is you have sort of like a rainbow coalition up here, okay? But we all know that in our states, and for historically oppressed and marginalized communities, oftentimes we are segregated geographically. We have our hood, you have your block, you got your project, et cetera, et cetera. We are also often segregated in policy. We are often fighting and competing for resources. This portion, this percentage will go to minority-owned communities or whatever that language is. And so I just really want you to help us bring forward how you all made the commitment and the successes to bring forward unity so that you could come together and advance policy in Arizona.
Thank you, Denise. Before that, I just want to say that it was hard, right? But one of the things that I have to say as a CHW, I have many years in mobilizing and organizing our communities. And as a former farm worker myself, that's when I began organizing. I followed Cesar Chavez and did the strikes and all those things. And one of the things that I remember very clearly is my dad one time telling us, said, you better always stand up for yourself, because I am raising strong women. And I want you guys to always remember this. And he was really thinking about when we got married, don't let anybody really get over us and really hit us or maybe even be unrespectful, right? So he was thinking in that direction. And now I think about that, oh, maybe that's my ex-husband left. He couldn't take it, right? My dad did raise a strong woman. So, no, but realistically, I think that when I was working in the fields, I was the one that spoke the language. So everybody looked at me to read the letters and interpret. When the foremen and supervisors got an inspector, they would call me to. So I would be in the know of what's happening. So a lot of times I knew that they were going to put us in the field. They were still not ready for us to go in because of the pesticides. So I would come back to my crew and say, let's not go in there. There's still pesticides, and the supervisor knows that. So I know that in organizing, and you always have to speak up. And that's what my dad really told me, to always speak up. And when I started working as a CHW, I began working in HIV STDs, and still working as a migrant farm worker. So I was the condom lady for many years. And everybody came to me because they were looking for interpretation, but they were really asking for condoms, right? They were not ready to talk about that. So it was really bringing barriers, challenges that we have in our systems that we don't talk about a lot of stuff. So when I started working as a CHW, I was still in the fields, but I went out and started really looking around. What was I really? A CHW? What does it mean? A promotora, right? Because I was a promotora de salud. And what does it mean? So I had to really educate myself to know who I was representing. So when we got some grants, and fast forward a lot of years, I've always been working, and I cannot take credit for this. I've always been working with a small group of friends, colleagues. They have always respected us, regardless of having no education. They were all at the university level, and a lot of times I remember that I would say, what can I say that is important for them to hear? Because I was intimidated that I didn't know what to say. And Sam, if you're here, I love you. And I want to just also say that when we started thinking about organizing Arizona, we founded ASHW. That's what I call ASHW. In 2000, we started a conversation. In 2001, we came together. And many years after, we started thinking about what was going on in other states. What were they doing? What can we learn from them? So in 2014, one of my colleagues and friends, she got a grant. And she asked me if I wanted to apply. She only had part-time, so I was working full-time in an organization developing and coordinating programs. And I said, but I'm a single woman. I need a full-time job. I said, I know, Flor, but we need you. And I stepped out of my full-time job to come to work part-time in organizing the state. So the first thing that we did was, again, look at our state. Who's around the table right now? Because when we initiated ASHA, around the table we had promotoras, CHRs, and some CHWs. That's when I learned about the CHWs, because we didn't use CHWs back then. And when 2014, when we came back, and we started looking around the table, I said, okay, we don't have the same people anymore. What happened? And that's one of the things. When you start uniting, when you start working together, we need to continue working together. Because there's a lot of turnover, but we're still the same community. We need to find each other, identify each other, and continue working. So with the team that we were working, we identify what are the priorities that we want to really bring together. And one of the first things that I said, we need the voices of the CHWs. So for 1 year in that grant, I went around Arizona and met with promotora groups, CHWs groups, volunteer groups, CHRs in the north, in the south, in the east and the west, everywhere. I was 1 year in my car trying to organize and bring together. And of course, I was not by myself. I could be by myself, literally in my car, but I knew I had everybody working with me. And once we did that, we developed recommendations that we had from the voices of the CHW promotoras CHRs that you had met with. Those recommendations were brought together to the group, and we said, okay, this is going to be our base. When we submitted legislation, that was our base for legislation. The voices of the CHWs, the promotoras and CHRs, were carrying forward. And one of the things that when we started working, developing the language, you know that you have to speak the language that the policymakers want to hear. So it's like one of the things that we are not going to be moving is this. This is what the CHWs want. And when we saw the recommendations and the 1, 2, 3 priority for the CHWs, we always talk about the CHW sustainability. But in reality, the CHWs wanted respect, wanted recognition. Broadly, yes, but internally in their organizations, by their supervisors, coordinators, managers, directors, they wanted for them to understand what their role was, so they can really be effective in the skills that they had and what they could offer their organization. So that's how we really started putting together, making sure that every single step was really following the needs and the wants of the workforce. So when we submitted legislation, it was, as you all know, many, many trips to state capitol, making sure that we met with specific groups, identifying who were the key persons that needed to hear the message, making sure that we were ready for the no's. There's going to be a lot of no's, but making sure that we know that those no's don't count. Let's put them to the side and go look for the yeses, because we know that there's some champions in there. So when you continue moving forward, when you continue uniting in one voice, because this is one voice, you cannot take your own voice. You have to carry everybody with you every single time. So making sure that when we started doing this, it was not only Flor testifying. We had one amazing advocate from the White Mountain Apache. I know you're over there. And it was Priyo Johnson. Priyo Johnson was an advocate. She was so great in uniting the CHRs with us. And she's no longer with us, but she is still in spirit, and her legacy still carries. But also, another person that was really instrumental, Brooke Bender, I know you're here, and Halapai Tribe, and he was also there every single time. We had promotores, and we had CHWs. And even though somebody was talking, they were all standing in back. So it was not only one voice, it was the workforce represented, making sure that we were always uniting. And it was not easy because, of course, if you have not been working together for many years, how can I trust what you're saying? Are you really carrying my voice? But when you start developing every single thing together, and everybody has a say in what you're going to be putting as the final language, that is when you really respect and unite the workforce. And what the most important thing is that even though we had a lot of allies around us, supporting us, making sure that we felt supported, that we felt that we were not alone, they allowed us to guide. They allowed other voices to be heard. I remember one time that we were testifying, and we got a friend, one of my friends from Yuma. She was in the state capitol, and she was in the House part. And she said, Flor, I'll run your bill. Awesome. So she did. But she was on the other side of the aisle, and so it died in the Senate. It was not her. So, okay, we came back and said, okay, what do? We resubmit. So what do we go? Go to the other side and look for the other side, champions in the other side. There was this person that had the key, and she was really the power person to allow us to take our bill forward. And I followed her to the restroom. I followed her to the restroom. I said, okay, she can't not escape. And I said, Senator, can I have a word with you? He said, I have to go back to my seat right now. You only have 2 minutes. So, all right. That's it. All right? No, wasn't that it? So I allowed her to go back. Once the session finished, I went outside the door and I stood there. And it was, let's go. No, she's going to get out of this door. And I waited for her until she saw me say, oh my God. She said, and again, I approached her and she said, Floribella, I will give you 5 minutes in my office. Contact this person and I'll give you 5 minutes. I gathered my friends that I knew that needed to come with me, and we went to see her. We were prepared with documents and data and everything to make sure that she understood who we were and the vital role that we play in our health system in Arizona. And when we were with her, she did not give us 5 minutes. She took over an hour to listen to what we had to say. So it's not really that one person makes a difference. We all make a difference. Yeah. And we cannot continue moving forward if we do not unite us. We need to unite ourselves. It doesn't matter if you're in Colorado, if you're in Texas and I'm in Arizona, or you're in Massachusetts. We're still one family. We live in different roofs, but we believe and we have the same values. And we need to continue pushing forward to make sure that this workforce is not only recognized and sustained, but it continues growing, and it will expand. And because there's certain levels, and certain levels, I mean, when I began, I told you I was a condom lady. That condom lady is now making sure that we move forward and that we're heard at the national level. Because it's not talking about one specific program that's funding us. It's talking about a profession that we're developing, that we're strengthening, that we're making sure that it's sustained, that it's recognized, but also that we had made history because we were the first responders in COVID, and we are still responding every single day. So.
So good. You know, I'll use as a transition what Flor was just mentioning about our values. You all know I've said it today and yesterday that the founding board of directors gave us values for the National Association of Community Health Workers. They include self-determination, self-actualization, health equity, social justice, dignity and respect, for all individuals, integrity. The values are important because for me, leading this organization, and hopefully for you all as members, it's easier to find authentic allies when you're grounded in your values. When you're living your values, you leverage those values to confirm that we are not veering away from those values as we seek funding, as we seek to build an organization, as we seek to write policy. And the values have been very critical to me as a young leader to identify authentic allies. And so I'll use that as a segue. In April 2020, I got a phone call and I was asked to be on a webinar. I was utterly terrified. I'd never been on a webinar, ever. So I wasn't quite sure what that was. And I had to get a Zoom account and all those sorts of things. And I met Katie Bolbeck on that webinar. She and other team members here are representatives of Partners in Health, a global organization, an organization that is continuing to live on the values of Paul Farmer, their founder, who passed not so many months ago. Some of you may remember we helped to acknowledge together his passing and also the legacy. But Partners in Health was one of the organizations that came together with other global organizations to do a couple of things. One, they made a commitment to leverage their resources and expertise, both policy and programmatic resources, to respond to COVID-19 in the United States. They also, by way of many other sort of structures, we eventually co-founded the Community-Based Workforce Alliance, but they also helped to put the National Association of Community Health Workers in position to be able to communicate with organizations like the Health Resources and Services Administration, to be seen by the White House, right? To make connective tissue with senators down at the Hill. This is big stuff for me, who had been a CHW in the city of Hartford, Connecticut, in like working in a 1-mile radius for 20-something years. So I want to say that, as Lisa Renee said earlier in the Founders Circle panel, allies are critical, right? Allies have expertise and values that align with ours and are ready also to leverage their privilege and their positioning to draw down those resources to further the movement. And so, Katie, we've been doing this for a couple of years. We've been talking in many different spaces, and we've had some wins, some not so big, you know. I want you to leave us in this panel talking about not only partnership, because I think partnership is important. Flora mentioned making sure that the workforce is leading in all things, but also helping us redeem the time. One of the things that Partners in Health helps us do is mine all of the policy documents and help us to understand what's next at Capitol Hill. So thank you first for being an authentic ally organization, and talk to us about where you are and what's next.
Thank you, Denise, and it's our absolute privilege to be at this table and to have been invited to the table to be an ally with this extraordinary set of leaders and advocates and organizers. You know, as Denise said, we are a global health social justice organization founded in Haiti, work in 12 countries around the world now, including the US, but of our 18,000 staff around the world, 11,000 are community health workers. So CHWs are the heart and soul of our work and who we are, and you know, it's our absolute privilege to follow their lead and to really accompany and advance the agenda that's set out by the frontline workforce and the leaders of community health worker movements around the world and here in the US. So, you know, it's been quite a journey these last few years, really diving in head first together with these extraordinary partners to this fight to really advance work that has been, you know, folks have been at this fight for a very, very long time here, and the momentum that has been built over these past many decades that we think, you know, COVID has really offered an additional accelerating force around both visibility, opportunity, funding, and power building, that we feel like we're at this really incredible moment right now. We're really at a tipping point where both at a local and state level, if you've heard today, there's just this incredible movement building, power building strategy that's being developed, but also at a national level that we're seeing real movement. And so I want to highlight a couple things in terms of what's next, or where we're excited to continue to work with and support NCHWA and other partners at that national level. I think already highlighted today, we see CHW Awareness Week as an incredible opportunity to continue that fight to just raise awareness, understanding of who CHWs are, why their work is so life-saving, life-giving, essential, why it's not a nice-to-have part of the workforce or component of a health system, but why it is the missing kind of lock-key component that the U.S. has just struggled to really invest in and elevate in the way that many other countries have been able to. So, you know, I think there's that continued fight to get in front of policymakers and decision makers and make sure they understand who community health workers are, what they do, why it's so important, while also advancing very specific policy asks, budget asks, you know, decision points with them. So I want to highlight a couple things at the national level. We're working with NCHWA and others on one, both, you know, around sustainable financing, which I know has come up today and is a real top of NCHWA's agenda as it is ours to support more sustained funding to get out of this boom and bust cycle that has caused so much harm generation after generation to community health workers and their communities. So first, really exciting development in this year around Medicare financing. So we saw the Centers for Medicare and Medicaid Services, the federal agency that oversees Medicare, put out a proposal this year to include community health workers in Medicare payments for the first time ever. So this is, a really potentially transformative set of funding. Medicare covers 65 million Americans. So the potential reach and the potential sustainability of this funding source is huge and could really unlock really transformative dollars for community health workers and their work around the country. But there's some pretty big questions about exactly how this is going to be rolled out, what this will look like. And so it's so critical that community health workers are at the table advising and driving what this is going to look like. And we have a window right now. So they released this proposal, comments. You can submit comments and feedback on the proposal until September 11th. And so we have another stretch right now to put our point of view, data, experience into that conversation. And those changes would take effect in January 2024. So this is moving quickly, and this is a really exciting opportunity to really drive that agenda. If you want to learn more about that or get involved, you can reach out to Catherine, Angie, NCHWA's policy team, or Ali and Lucas from the PIH policy team are down here as well. So that's one piece in terms of ways we can influence some of that national financing landscape. The second I wanted to highlight is some national legislation around CDC funding for CHWs. So this is something we worked together to fight for last year. At the end of 2022, Congress passed a piece of legislation into law called the Building a Sustainable Workforce for Healthier Communities, which essentially authorized a new grant program that would be $50 million a year to CDC indefinitely to support CHW programs. Which is good. Yes, as Denise was saying, step one, check. But what that legislation did was it basically built the cup for funding. It said we've put into law that this cup is here, but it didn't fill the cup with that $50 million yet. So that's our next fight, is continuing to push on ensuring that Congress fully funds that $50 million a year into this program. And we're also pushing on ensuring that there's funding within that specifically dedicated to community-based organizations employing CHWs. So if you're, this Congress it's going to be a tough road this year in terms of the current budget fight, and we know, there's broader cuts being proposed, so it's going to take a big push to ensure that this gets in, but we feel like there's a path, and we've got the power, the data, the people to do it. And so if you're, again, interested in making that part of your CHW Awareness Week push or want to get involved otherwise, come talk to any of us about that. But we feel like $50 million isn't, going to do the job, get the job done, but it's an important and meaningful step forward along with some of these other pushes on state Medicaid reform, on Medicare expansion for community health worker services. So just wanted to highlight those two as sort of exciting National CHW Awareness Week kind of potential asks or opportunities. But we know all of the work that all of the allies and advocates and the shoulders we've been standing on in doing this work have been building champions in Congress, have been building champions in their state legislatures, in other power bases in their communities over these past many years. We were able to get some of us together in March to go down to the Hill to do an advocacy day together to do that broad awareness raising work about making sure folks understand who are representing us in Congress, who community health workers are, why they're essential, why we need more sustainable funding, but also to push some of these specific asks along the way. We're really excited to hopefully get an even bigger crowd together next year to do that and really show up in full force. But in the meantime, through a lot of that shared work, have been so excited to have a couple of those champions in Congress who have committed to introduce a resolution recognizing CHW Awareness Week on the Senate floor officially, and that resolution is based on NCHWA's 6 pillars and will really reflect all of the incredible work done to articulate those values, that approach, and that will be a great, we hope, advocacy tool as well to go talk to your legislatures to say, hey, did you see this resolution that was on the floor? What do you think? Here's what that means for me and my community. And again, couldn't just echo more what has already been said so eloquently and beautifully about the power of, going in with data, your policy language, your specific asks, but nothing is more powerful than being able to tell the story of who you are, the patients and the clients and community members you're caring for. We saw that over and over in the Hill Day in March, just how much that was the thing that changed a conversation with the legislature more than anything else. And so thank you for all of the extraordinary advocacy work you've already done. It's again, our absolute privilege as partners in health to be allies with you all in this fight. And we're here to support and accompany long term, so come find us and look forward to continuing the fight together.
So I'm really excited to hear from my colleagues here all of the great things that have been happening. And I've been looking out and watching lots of folks take lots of notes. And I just want to say that's really cool, right? Because you're getting some ideas, what can we do next? But that's what I want to call folks out on, is what are you gonna do next, right? It's great to sit there and take all these notes, but we need to do something with that. We need to have some collective action, right, to move our workforce forward, to make sure the communities that we're working in, living in, are taken care of, and that our workforce has some sustainability and that folks are getting paid. So I just wanted to say, take your notes, but utilize them. Do something with those notes when you leave here.
Thank you so much for saying that. And also, you may have noticed in the agenda that tomorrow morning there is an opportunity for folks to convene regionally. So we're going to have roundtables, and you can come based on the 10 HHS regions. We're making space available, and we'll have some facilitators who are going to reinforce access to the CHW Awareness Week toolkit. They're going to make sure that you know where you can find this information. You don't have to be a member to be involved, but we invite your participation. But this is an opportunity for you to step up at the table and say, hey, I want to do an event. Who's in Arkansas? Who's in Connecticut? How do I get your... Come on, Cleveland. Where's your? I know a Vision of Change is about to do something, but how can we get organized? How can we stay connected? So we're trying to make some opportunities, but we know you're doing that on your own. You can also find one another in the app, but it is absolutely about holding us accountable, and also you as members and partners stepping up and celebrating the CHWs, promotoras, and CHRs in your state, commemorating the excellent work that you have achieved thus far and pushing for that work, and also collaborating, making sure that there is diversity of representation in the workforce, that we don't miss by race, ethnicity, gender, sector, culture, language, lived experience. Let's use this as an opportunity to confirm that we do have things in common, that there's an urgent moment, and we want to take advantage of that together. Let's turn you back into the hands of Catherine right now, and thank you so much. The panel was amazing. Please clap it up for the panel.
I know Denise said a couple of times this is good, but this has actually been incredible. Thank you again to the panelists. You guys, I've had the privilege of hearing these stories on many different occasions and having these conversations and learning more about these panelists, but there is just something about the power of your story, the power of what you have accomplished, and the fact that we can all follow those steps and continue this movement going. So thank you again. Now, I know Lisa Renee talked a little bit about just taking notes, but we know there might be some burning questions out there. So we have located 2 mics right under the hanging speakers. If anybody wants to get up and take this opportunity to ask questions, maybe you're wondering what's next, how you can participate in CHW Awareness Week, how can NCHWAW be of support, please feel free to use this opportunity to ask us or any of the panelists a few questions. And while folks are making their way up to the mic, I just want to continue to talk a little bit about the logistics of CHW Awareness Week. As you know, and I'm sure you've had it in your email, and a lot of you have attended our kickoff webinars and our Q&As, but to continue the spirit of what are we going to do during CHW Awareness Week, we want to reassure you that we have also provided tools through the NCHWAW website and the CHW Awareness Week page where you can actually find a toolkit. And this toolkit is really a step-by-step guide on how to get together and really keep up the theme of the 3 C's, which is celebrate, commemorate, and collaborate. I almost forgot it. It's been a long day. But these are really important because there is not one way to celebrate CHW Awareness Week. There's not one way to have an event. There's not one way to reach out to your legislators. There are a lot of different ways, and you can do that through your institutions. You can do that as individuals. You can post on social media. You can join another event. We really want to make sure that we underscore the opportunity that CHW Awareness Week is to break out of our silos, whether those are regional, whether you want to collaborate with somebody across the country, where you want to celebrate some OGs, like Denise likes to say. All of those acts are very important and are substantial to making sure that our first annual CHW Awareness Week is successful. So if we don't have anybody at any of, we have one person.
You have a one.
We have one. If you can please introduce yourself, tell us your name, where you're from.
So I'm Brooke Bender. I work with the Wallapai tribe, former CHR, CHW advocate and ally, and I work as the director for senior services for the Wallapai tribe. My question has to do with Medicaid reimbursement. As allies, I guess this is an ally session, but I really would encourage, and I would like to know what NCHWAW is doing to help build reimbursement codes, because I've noticed that Oklahoma, North Dakota, Arizona, Nevada, New York, each state has a different type of code that is reimbursable for CHWs, but there is no standardized code for a model for that, and it really does put the power into CMS's hands at identifying what CHWs are worth and what their reimbursement capabilities are. And we need an advocacy with CMS, like NCHWAW, to start advocating with CMS and local, your local state allies and associations to start advocating fully for a standardized reimbursement model, because I can say CHRs in the state of Arizona are only allowed to get reimbursed for health education and individual one-on-one and a health and a group session, but there's nothing else identifying that can be reimbursed. The education is not limited, but there does have to be a referral from a medical provider to do that. That's also at the help of Florabella, who really did work hard for that as well. But there is a difference in that, as in North Dakota, they can actually do treatment, and not treatment, but they can do assistance in case management with individuals with diabetes and renal failure. It was and that's one big difference, is that one can do it, but with only education. Another one can do it with education and case management. And there really does need to be a standardized code, or an effort to advocate for that standardized code for CHWs nationwide.
Thank you so much for the question. I'm going to do sort of a rapid fire, because obviously maybe this is one of the sessions in one of the other workshops, but I want to be brief, and then maybe Lisa Renee, you might want to talk about Massachusetts, or you might want to talk about Utah, Areta. So let me just say a couple of things. Of course, folks know that Medicaid is a state-coordinated, a state-run program. Okay, that's important for context. Let me say I'm going to say a bunch of things, and for framing, because I think framing is important. The first thing that's really important when we talk about policy and the work of the National Association of CHWs, we welcome being invited into states by CHWs to have conversations about your state policy, right? State legislation, for you to be identified as a workforce, discussions perhaps with your state health department if you're, having those conversations, and or having conversations and developing TA around Medicaid. I say it in that way because the National Association, we are not speaking for you in your state, okay? We want to be your partners. We want you to know that we support you with language, with policy language, with research, with data, but we actually don't come into states. I don't reach out to your governor and say, hey, let's make this happen. Does everybody understand? It is self-determination is really important. Every state, every CHW community is in a different place. I could say a similar thing about certification, but we just don't have the time. But this is one of the reasons that when you see our founders, you see such diversity in approach. Okay, we're learning from one another, but we don't speak on behalf of. We will speak with you if you so choose. So I'll unpack that maybe a little later. We can connect. But I want to say that that's important. Now, having said that, if you go to the NCHWAW website, to our policy page, there is much that we have said, okay, to other federal agencies, including CMS, about what we envision. Okay, number one, if your state does not recognize you as a workforce, you're going to have challenges both with your health department and with your state Medicaid office. Because without that recognition, it will be difficult to have a scope of work that will allow you to then design the cohort of services, right? The unduplicated roles of your profession in Medicaid. And a lot of what we know we've experienced is that social workers or nurses or case managers or others think that we are trying to step into their scope of work. So when we talk about advocacy and sustainability, this is why we try to broaden the definition of sustainability. You cannot have sustainable financing if we are not identified as a unique workforce without our own competencies and roles. You see, we have to be recognized as a profession. So there are many components to achieving the piece that you're talking about, which are the codes. Let me just say one or two more things. I'm sorry to be so long-winded. There's a fantastic resource that we've put on our website, some research that was done by a woman named Erica Selesky and others out of Kansas City and Missouri. It's an incredible toolkit from Medicaid, where they combed through all of the codes and identified every conceivable code that could be used to aggregate the reimbursement and the roles of community health workers. Because we know Medicaid does not do everything. It does not pay for everything. So what I would offer to you is the national policy platform. I would offer to you the letter that we wrote to CMS, highlighting what we thought were critical components to advance CHW's roles in Medicaid. I would offer you that toolkit as well, and happy to unpack that. Perhaps we can push it in the app. The last thing I want to say to you is that tomorrow morning, you'll be hearing from the Centers for Medicaid and Medicare Administrator, Chiquita Brooks LaSure. I met with her in DC and asked her to be a part of this conference, and she said, invite me and I'll be here. So you'll hear from her tomorrow morning.
I just want to add, and this is not a specific answer to your code question, but I want us to always remember that Medicaid funding, Medicaid reimbursement, whatever we want to call it, is only a piece of the puzzle for sustainability and funding for our positions. And so we want to be very careful not to put all of our eggs in the reimbursement Medicaid basket.
Yeah, I was just going to add to respond to that. Even for us, we're at that stage of just looking at what is best for our state and where we are. Applying for Medicaid and the way you need to apply for it is also different. You're looking at either 11, 15 waivers or spas or, all these different things. And it's not set up so that everybody has that same kind of standard. And so you have to do the homework in your own states about where they are, where our politicians are with it, and really tailor your approach if that's one of the ways you want to look at sustainable funding, because we're just doing that work. And we've built all the things that I mentioned that we've done were steps we needed to do to bring credibility to who we are as CHWs. And that's why I'm just going to plug this in before we end. The Awareness Week is so important, but the awareness every day in the work that you do is also very important.
Every moment of every day.
It's got to be a build-up. And to add to that, the allyship, we need each other's allyship. I know there's many CHWs, we only do maternal, or we only do chronic disease management. Well, when these bills come up for all the kinds of work that we do, we need to support that work in policy, at the policy level as well, because if they see the need and they're overwhelmed with the need, as they always are, who do they come to? And so just wanted to share that that's what we're looking at now, that there are these stages and steps in looking at what's best for your own state. But again, like Lisa Renee said, don't rely on just Medicaid reimbursement.
Thank you so much. We have one more question, and then we will be wrapping up. Go ahead.
Good morning, everyone. My name is Cheryl Garfield, and I'm here for Project Champ and Penn Medicine. Hi to the panel and everyone that's here. I just had a question. So I was thinking about how could NCHWA, along with all the organizations here, come together to form a million CHW walk on the Capitol to address all that we need. I mentioned this to Denise like a couple of times in meetings we had, but I think that that's going to be our best way, because together we are a strong force and we need to fight for what we know we need in each state.
Thank you. Go ahead.
I just want to say, remember, we are PhDs. We are prepared, we are humble, and we are dedicated. Yes. Remember that.
And on that note, we want to give you our most sincere thank yous for being here with us today. This has been incredibly just energizing in terms of coming away knowing that in this room we have the power, we have the voice, and most of all, it looks like we have a lot of dedication to making our first annual CHW Awareness Week such a successful event. So thank you again to our panelists. And yes, I want to reinforce the dates for CHW Awareness Week. It is the last week in August, so August 28th through September 1st. And if you go to our website and you sign up for our mailing list, you will be receiving information leading up to CHW Awareness Week of all the different events that are going to be happening regionally and ways that we are going to be able to support you all. So thank you again for being here today. Thank you for coming to Unity. And thank you so much for your energy. We look forward to moving forward to CHW Awareness Week.